Welcome to Green Peak Alliance for Your Health. I'm Elizabeth Kelsey, and I'm here with Loree Zeif, a licensed clinical social worker from Manchester, Vermont. Today, we're going to talk about anxiety, social anxiety, and depression, and why people who experience these conditions sometimes self-medicate with alcohol or drugs. Hi, Loree. Welcome to our show.
Hi, thank you. Good to be here.
So you work with clients in your practice who experience anxiety, social anxiety, and depression. What are you hearing about their experiences, and what are you hearing from you specifically?
So I think I think we all know that we're seeing an increase in what we're referring to as anxiety and depression. And I think that is, I think two things. I think part of that is maybe a little bit of an elevated thing. I think we've got some, I don't know if we want to call it confusion or distortion in young people between sadness and depression and between nervousness and anxiety. So I think part of the reason that we feel like we're seeing these elevated numbers is that and it was sort of been a big buzzword lately, but resilience, the lack of resilience. And I do think that there's a piece of this generation of young people that does lack a little bit of an ability to, respective of previous generations, to dig their heels in and push past what is really some sadness or nervousness. Mm-hmm. And instead they label it as anxiety or depression, and that sort of automatically elevates the feeling in their mind and sort of makes it more of a problem and less of an hurdle to get over. So I think there's that piece of it. But the other very real piece of it is, I think we are seeing a true increase in anxiety and depression because these kids are bombarded, and I'm going to refer to kids as young, everything from adolescents through young adults, because I think we're really looking at this like 15 to 25-year-old group of people where they're bombarded with news and information all the time. So it's the screen thing is a double curse. It's taking up a lot of time and energy that would probably be better spent doing other things. But it's also, when I am 57, so when I was that age, I either watched the news at, say, 6 or 11, or I didn't, most likely didn't at that age. Mm-hmm. And I may have picked up a newspaper occasionally, and it was like one blip of, the Korean War. It wasn't a constant barrage of information about, school shootings, the climate, the president, whatever it is that kids are worried about, it is sort of in their face all the time. And I think that that's had a detrimental effect and has raised the anxiety level. And I guess a third issue is there's a lot to be anxious about. The climate's in trouble, Our president is causing waves, and kids are getting shot in schools, and those are very real things. It's not that very real things weren't going on 50 years ago, but these do seem like bigger, more cataclysmic events that these kids are worried about. So I'm forgetting what your original question was. I guess that's what I think we're seeing, and it's coming out in ways that for a lot of these kids, they have trouble putting words to it. They have trouble understanding it. They know that there's this worrying thing, and they sometimes have trouble sort of identifying where that's coming from, and certainly have trouble managing it.
Why do you think they're having trouble putting words to it?
I think, and we're going to talk about drugs and alcohol, but one of the things that I really put in the same boat as drugs and alcohol is screens. And I think we are far less engaged as people than we have ever, for sure we are, than we have ever been in the past. And kids just aren't getting the practice that they would have gotten. Kids are not sitting down and having dinner with their parents the way that they were absolutely doing, not that long ago. not to point blame at the parents, I think that it's the culture that we're in, where people are busy and living in silos under the same roof, and there is something lost. There's a loss in sort of practice about engaging with other people and subsequently with yourself. Really, reading what other people are seeing in you and that being reflected back at you, and it's a problem. Mm-hmm. Yeah.
Yeah. So there's a risk when someone is experiencing these things, anxiety or depression, for that person to self-medicate with alcohol or other substances. Wondering why this is, and if alcohol is itself a depressant, why would a depressed person turn to alcohol? And in the case of anxiety, why would someone with anxiety turn to alcohol? Are there different reasons for the different conditions?
Well, anxiety and depression are very much sort of engaged, right? We treat them similarly clinically. We treat them similarly pharmacologically. They're typically go hand in hand. One may precede the other, but they typically go hand in hand. So I think we can talk about them together. And I think the answer is alcohol. If we're talking about, when we talk about drugs, that's a big word. But if we think about marijuana, which is what I most often encounter with young people, and with a lot of people these days, the reality is alcohol or smoking weed before a potentially anxiety-producing event helps in the short run. Mm-hmm. It helps. So in the beginning, it does make things easier, most often. And so that becomes sort of our learned, response to how to manage things. At the end, using that as a coping strategy, using alcohol or any kind of drug as a coping strategy, what it does is it atrophies our healthy coping skills, right? So we don't learn to push through the anxiety of walking into a cafeteria and finding a place to sit if we get stoned first. If we get stoned first, then that numbs us through it, and we get through it, but we haven't learned that, it really wasn't so bad. Or, well, it really was bad, but I survived and I'll be okay, and tomorrow maybe I'll do it this way. Mm-hmm. So that's alcohol, and certainly right now marijuana are pretty acceptable for a lot of people, and certainly for young people. And so if you've got this vague sort of worrying thing in your mind about, entering the cafeteria freshman year of college, and you've got weed in your room, which you probably do, that fixes it in that moment. And then it becomes, often this sort of sometimes this path toward a problem.
And so we never learn to deal with the sources of our anxiety.
Right. So when we push through anything that's difficult, being on TV, right? So that's something that for a lot of people might be anxiety producing. Mm-hmm. When we do it once, we get informed about, it was really hard, but I did it, or that actually wasn't hard at all. It was like sitting in my living room. It was no big deal. Whatever it was, and that informs us. And then the next time we manage it the same way, differently, whatever. Mm-hmm. If we smoked weed first and then sat here, we would come out of it having gotten through it. Maybe it would have been easier than we thought, but our brain would have said, and that's how we get through it. Mm-hmm. And so then we didn't learn any healthy coping strategy.
And you'd mentioned screens. Is that something else that people use to sort of escape or numb themselves with somehow?
Yeah, so without a doubt, right? So, and that is such another, double-edged sword, because if you're lonely or bored or just, worried, whatever, you can go down the rabbit hole of YouTube or games or Facebook or whatever it is. So two things. It's a time suck for sure. Before you know it, time has gone by and you haven't done other things that maybe you should have been doing. Writing a book report, doing something for your job, playing with your kids, whatever it is. The other side of it is, if you're on social media, you're watching everybody else have their, 5 minutes of fabulous for the day, 5 seconds of fabulous for the day. And you get this sort of sense of, yeah, my life really does suck because this person's doing all this. For everyone, it's their highlight reel, but I think it's hard to keep that in perspective when you're spending your time just sort of scrolling through. Very seldom do people put, how bad their day was on Facebook, or the kids are all on Instagram and Snapchat, but it's mostly good stuff.
Mm-hmm. Yeah, very unrealistic.
Yes.
You talked a bit about how the self-medicating with alcohol and substances makes the anxiety and depression worse because we're not sort of breaking through those uncomfortable feelings and experiences. Can you say a bit about what's happening in the brain?
Certainly there's the numbing aspect, which is really what people are typically going for, the relaxing aspect. But ultimately, the biggest concern with alcohol is addiction. I think, with marijuana, while there's not sort of a chemical addiction that we can put our finger on, there is, I think, a more loosely we can use the word addiction a little more loosely. It's about you get addicted to being high, like that's how you know how to get through things. And we're seeing increasing numbers of that. I mean, while it's legal in Vermont, and this is absolutely not I don't advocate, I think it should be legal actually. I'm not advocating against it being legal, but it's legal for 21 and over. I think as we've moved toward that, we've gotten a much sort of, we're seeing kids with a sort of a sense of, this is what I do, kids referring to it as their medicine, kids really feeling like it's acceptable and reasonable to be high much of the day. Certainly one of my biggest concerns is they think it's okay to drive and be high, and they're really like pretty adamant about it, which is, I think for obvious reasons concerning. What I say to kids and to parents who struggle with controlling these things is, if your kid was waking up and laying in bed and drinking a beer, you'd be really upset, probably. So you should be as upset if they're waking up and laying in bed and smoking a joint or vaping or whatever they're doing, because either way, they're starting their day by giving themselves a message that they need this to get through the day. Mm-hmm. So whether or not there's a chemical addiction to marijuana, that's a problem in my mind. So I say the same thing to kids, just like, would you ever sit in your room and drink a bottle of wine? And the purpose of both typically is to either numb things or ease things. And there are other ways to do that. Mm-hmm. I think coupled with that sense of relief or ease that people are getting, which motivates them to continue the behavior, is shame. Because I think people know, right? So then that's where we get into people hiding things and giving themselves a message that they're, worthless or not doing what they should be doing. Like that's the other side of it. And I think that helps to drive this cycle that we get of using alternative methods to cope, feeling crappy about it, getting depressed, needing something to manage the depression, going to the go-to thing, which is the weed or the alcohol, and on it goes.
Mm-hmm. Yeah. And wanted to talk about prescription medication. If people are taking prescriptions for some of these conditions, once a person has begun to self-medicate, how does that affect treatment, counseling, interfere with prescriptions? What does that look like?
Are you talking about if people have a prescription for like an SSRI or something like that?
Yes, yeah.
And how does that work with, the labels will all tell you, and everybody knows this, that, you shouldn't be drinking or using other illicit substances if you're on those medications. I mean, the reality is a lot of people are on SSRIs or the like right now, which would be your Wellbutrin, your Zoloft, your sertraline. And most of those people are not necessarily stopping the use of alcohol or weed. I'm not a doctor, and I can't speak to the reasons medically why that's a bad idea, but it is sort of you're taking this to combat depression, and then you're drinking 6 beers in the same night. So where are we getting here? Mm-hmm. So I think it's not good. I think, and I encourage people, especially when they first get on medication that's prescribed to them, to really consider the value of not doing anything else simply for purposes of information. We aren't going to know if this is really working if we don't have it in a little bit of a vacuum so that we can tell whether you're feeling a difference or not.
Mm-hmm. And sometimes, and we're talking like, adults would use, might drink alcohol, for example, to just as a crutch to get through a difficult period. Mm-hmm. Can you talk a little bit about the trajectory of how that could turn into a longer term problem, even though it's just sort of like they think of it as a short term?
Yeah. I mean, for a lot of people, it can be, and it is short term. And then for other people, there's a risk there. And I think, again, 2 things. One is the sort of fact that it informs your brain about how to manage something, and then you're more likely to continue to do that. And then we have, with alcohol, certainly we have the very real factor, which is chemical dependence, which for some people can happen really quite easily. And for other people, I don't know why, but for some people, the addiction piece kicks in sooner. We know that there are some genetic factors, genetic predisposition that affects that. I think the genetic piece is, again, a double-edged sword. I think you come from a family where addiction is sort of sprinkled throughout past generations, and so there's the genetic piece to that. In addition, you likely then grew up in a household where drugs or alcohol were what you did when you celebrated, what you did when you grieved, what you did when you were angry, what you did when you were content. Those are all learned behaviors, which then go hand in hand with the inherited predisposition, which those are the people that are the biggest risk for sort of that catapulting from it being a short-term solution to it being a long-term problem.
Mm-hmm. Can you define responsible adult use versus misuse and then addiction?
Yeah. It's interesting. There are a few books out there. One that I refer to people a lot, which I won't be able to think of the name of right now, but if you Google it, there are books out there. And it's interesting. So we've got the AA model, which says, abstinence and, there's a pretty clear path of this is a problem and this is how you manage it. And AA works really well for a really large number of people for a very long time. Then you have some people who sort of feel like, do I have a problem? Or, when did I go from drinking occasionally to drinking every night? I probably shouldn't drink every night. I don't really want to stop drinking every night. I see a lot of that in my practice, often from women my age, or people my age. And it's a very nebulous answer, like when is it a problem, right? So I think a few questions that I ask people, is it affecting your health? If it's affecting your health and you're continuing to drink, then that would indicate to me that that's a problem, because why are you choosing the alcohol over your physical well-being. That sort of tends to fly in the face of a rational, good decision. Is it affecting your job, your school, your relationships? Have you lost a spouse or a partner over drinking? Have you lost friendships over drinking or drug use? Have you lost a job because you come in late too often? Are you coming in late too often because you're hungover? You know, these are the kinds of questions, like how is it affecting your life? And if there's a negative impact, then why wouldn't you stop that? So I think that's where I try to kind of help people understand the line of normal and problematic and, whoa, we need to get you into some serious treatment and think about abstinence. Probably the most challenging place is that middle aisle, because it's black and white is always easier than gray, right? So I don't drink, or I don't eat gluten, or I don't eat dairy. That's in a lot of ways much easier than I just do things in moderation and I try to be really careful about it. And one of the questions is, do you ever think to yourself in the morning, I'm not going to drink tonight, or I'm only going to have one beer when I go out tonight after work, and then end up having more? I think that if that's happening to you, then you may want to really think about whether you need to be a little more constrained in your, and I think, people have very different opinions about these things. I think, sort of setting up rules for yourself is not a bad thing, much in the same way that, if you really can't stop yourself from eating the entire pint of Ben & Jerry's, you probably shouldn't have it in your refrigerator. Mm-hmm. So setting up rules for yourself that are I don't drink at home, or I only drink one drink, or I only drink on weekends, or whatever it is. I don't drink during the day, whatever it is that allows you to sort of maintain that middle line. I think that can be fine, and people can do well with that. If you're having trouble maintaining those lines, then I think you might want to think about whether, again, black and white might be easier than gray. Mm-hmm. Yeah.
And how does the issue of self-medicating for anxiety, depression differ between adults and youth, those under 21? And why is it that alcohol is just so present at many adult and family functions?
Yeah, that's an age-old question, I guess. I don't know. And I'm 57. It certainly has been present in my whole life at things, right? So, I don't know, and it's tricky. I think most adults are reticent to have a party or an event without alcohol. I think increasingly people my age are seeing, you have friends or family members who don't drink for a variety of reasons. And so I think I have found myself much more sort of thoughtful about having other, cocktail that doesn't have alcohol in it, or you can add the alcohol if you want, as opposed to only, really focusing on the alcohol if I entertain. I don't know. I think it's just a cultural thing, although it crosses, I think, almost every culture.
Yeah.
And it's a challenge, I think, because I think if I had a dinner party and didn't serve alcohol, I think people would think that would be odd. Yeah. But I've raised, I have 3 young adults that I've raised in that culture, and I've tried to be really open and thoughtful about just talking about all of that, and hoping that if children or young adults are being raised in a place where people are careful and, don't drink and drive and don't drink too much and enjoy it without over consuming it, that's all good mentoring. But I don't know. So culturally, that's tricky. The first part of that question was, how does it differ between adults and
youth?
I don't know if it does.
Yeah.
Actually, I think if kids are gathering, in my experience, by and large, and certainly there are religious reasons and family reasons that young people don't drink at all. But I think most of the time, if they're getting together, they're drinking, or more increasingly, I think we're seeing kids vaping or smoking weed, but
Right.
doing something.
I was going to ask what the message youth are receiving when they see alcohol at all these events, but you sort of spoke to that, and it sort of perpetuates just the whole cultural idea that alcohol is just there, has always been there.
Yeah.
And
I mean, it's how we celebrate, right? So, champagne. And I think we've, I think there's room, and we certainly see people serving mocktails and making festive things to drink that don't include alcohol. But if we go back as long as we can think, back to the days of Jesus and water and wine, alcohol's been a part of how we celebrate, how we do rituals.
yeah, and steps we can take so alcohol isn't always part of these events, and so that the lack of alcohol becomes socially accepted. It sounds like offering some of those alternatives at least could be a step towards that idea, like the mocktails or just some sort of, so alcohol isn't at the center of the...
Right. Yeah, I think if we're being honest, I think it's challenging to go to a party for any of us and not have a drink. So, but you might have seltzer with a lime in it. Nobody knows if that's a gin and tonic or a seltzer with a lime in it. And I think people are actually a little bit conscious of that.
Yeah.
Of not wanting to present as though they're not a part of the, part of the party.
Right. And how do we prevent this issue of self-medication to begin with? What should young people keep in mind, and how can effects like asset building, community and family support, developing a positive identity, decrease youth substance use?
Yeah. I think getting back to my comment about engagement, like people being with people, I think parents, teachers, mentors, community members, we have to really be thinking about engaging with young people, because if we're looking at the issue of young people using drugs or alcohol for the purpose of getting through something that's challenging, anxiety, depression, didn't get the job, didn't get the report done, failed a class, whatever it is, what we want is for them to manage that by going to another person, expressing their sadness, anxiety, stress, whatever it is, getting some feedback, putting things into context, and being able to say, okay, this is how I'm going to move forward. The only way they're going to do that is if they're connected to people. And it is remarkable to me the number of families that don't have dinner together as a family anymore. And we've got studies that show, strong correlation between healthier habits for adolescents and young adults and the number of times they typically had dinner together as a family. And dinner can be 20 minutes, and it can be pizza from down the street. That part doesn't matter to me. What matters is the sitting with someone and feeding each other literally and figuratively, and looking in their eyes and saying, well, how was your day? Mm-hmm. Oh, really? That happened? And, having a response feedback thing that goes on. That's a huge change culturally for us, that since... I think it goes along with screens, and it goes along with two working parents, goes along with busy schedules, it goes along with parents feeling like kids need to be super scheduled, kids feeling like they need to be super scheduled. Mm-hmm. I'm doing some post-divorce work with a family, and there's two boys, and they're very involved in baseball, and the mom, supports that appropriately, and so they're signed on for several baseball leagues. So they end up playing baseball, maybe not all year, because I don't suppose you can play in the winter, but a lot. And the dad, who has them every other weekend, so the mom's sense is, well, he doesn't support baseball because he doesn't, he sometimes doesn't let them go to a game or anything. And he comes in and he says, listen, there are other things that are important in life. I get that they love baseball, and I wouldn't keep them from their school game or whatever, but when they're playing in this summer league and it takes away my ability to take them fishing or camping or just spend time with them, I can go and watch the games at the tournament all day, but I'm not interacting with them. And, initially you listen to the mom say, he doesn't support baseball. That's not good, because baseball is important for the boys, and she's right. And then you listen to the dad and you're like, well, he's right. And I think we're in a culture where that stance, that there are other things that are important, more important maybe than the ball team or every play that the school puts on or whatever it is. Gymnastics, here if your kid does gymnastics, they're doing it in Rutland. That's an afternoon of driving and waiting and driving, which means you get home and there's no time for everyone, has a bowl of cereal and goes to bed, or you got McDonald's on the way home. And, these are tough balances. And I think culturally we are getting this message that these kids, to be set up for life, should be really focusing on their passions and honing their abilities. And maybe that's to a detriment, because I think when then we see that child, that ball player, that gymnast, that theater person, whatever, struggle, do they have the relationships or the ability to relate to people in a way that will help them get through the challenges? Mm-hmm. Yeah. No judgment to anybody. I think we're all struggling with walking these lines, and I think they're very challenging lines.
Yeah. Yeah. How can we recognize when friends and family need help, and what steps can we take?
So again, I think when we see the negative coping strategies, i.e. drinking, substances, screens, taking up time that would be better spent doing other things. And I encourage parents to really talk to their children, when we're talking about younger kids with the screens, to really say this: listen, if you're on your device and playing a game for an hour a day, I'm not even going to notice, much less have a problem with it. It's a non-event. You're then giving me a message that you're capable of balancing, a healthy amount of that particular activity. If I have to be on you, and if you're on it that many hours a day, then I have to get pretty strict with setting timers and turning off the power, whatever it is, to get you away from it. Because you're sending me a message that you're not capable of managing that time and balance. So I think what we think that there's a problem is when kids are waking up and smoking during before school, work, anything else. If they're smoking, if they're a high school kid and they're using weed on a Saturday night and not driving it, maybe we're less concerned. When we start to see those behaviors spilling into places where the good stuff isn't happening, I think, and that goes across, that's children, young adults, old people, for anyone, when you see that taking up time and energy that would be better spent doing other things, because there's only so much time and energy. So, yeah.
We talked a lot about human connection and expression of feelings as a healthy way to cope with feelings of anxiety and depression. How can we learn to start talking about our feelings with all these conflicting things, like the technology, the screens, sort of keeping us from doing so? Where could there be a place to start?
It's hard. I think getting back to nature, getting outside in a kayak, getting outside in a tent, going for a walk, just taking time. And so for adults who are mentoring or parenting younger people, really focusing on showing them that this is a good thing. This is something that we enjoy. So if parents are finishing the dinner dishes and saying, we're going to go take the dog for a walk, do you want to come? And they're engaging in conversation about anything, that's all good stuff. That's the stuff that we really are not seeing happening very often anymore. So I think teachers, coaches, all of it, it's all important and all good in all ways to, when you're engaging with people who are struggling, really letting it be okay and help. I guess one of the big issues is sitting with pain or discomfort. We don't do that very well anymore. We are quick to look for pharmaceutical help for those things. So I think being able to, with each other, just being able to sit with pain and discomfort, not trying to necessarily fix things, but being able to respond with things like, that sounds so awful. I'm so sorry that you had to go through that. How do you think you're going to manage it tomorrow? Those are the kinds of conversations that we want to be careful that we're really having with young people, especially.
Right. I think people can find it hard to just be around people who are in pain and they don't know what to say. Like some of the things you mentioned are good things, but is the most important thing just being there, just listening, and just like not avoiding the situation, not avoiding.
Yeah. And it's hard. It can be hard. And part of the hard part is if you're with someone who's not doing anything to help themselves. I think that's the most hard. So, being able to say, let's go for a hike tomorrow, as opposed to sitting with them in their dark living room while they're on their phone. Right. Yeah. So those are two very different things. Because I think one of the things we want to do is motivate better behaviors or more helpful behaviors. So we don't want to encourage the negative stuff. So that means I probably wouldn't likely want to sit with someone in their unless something tragic had just happened and they're getting through it. But as you might not want to sit with someone in their dark living room while they're on their phone just to be there for them. You might want to, the way that we motivate positive stuff is to say, I'm going to pay attention to the good stuff. So, listen, I'm going for a hike tomorrow afternoon. I'd love it if you came with me. It'd be great to hang out. Ways to sort of pull people toward healthier stuff.
Right.
Yeah.
Well, great. Well, thanks for answering all these questions. Do you have anything else you'd like to add on this topic?
One thing, I think it was somewhere in something that you sent me, was about sort of treatment programs. Ultimately, if we feel like drugs and alcohol really are a big problem, and we need to think about that. And so there are hospitals and treatment programs and all of that. One of my really favorite things to think about for young people is wilderness treatment programs, and that's where we have a couple here in Vermont, Summit Achievement and True North. We've got lots out west. North Carolina has several. What these programs do, they're typically 4 to 6 weeks. They can take children against their will or because kids are willing to go. What they do that I think is the most helpful is they take away all of in a dramatic way, they take away all the unhealthy coping skills, because the kids go off to this wilderness program without any electronics, certainly no drugs or alcohol. And they're typically off the grid with counselors in small groups. And it is very focused on communication and team building, and you're all getting a lot of exercise because it's typically hiking programs all the time. You're remembering how good it feels to climb a mountain. You're understanding how good it feels to be a part of a team and to be helpful to the group and to be a leader. You're remembering how to communicate because you have no option. You can't text someone who's standing right there. You don't have a phone. And the reason that these work, I think, well, I don't think that they're generally sort of a quick fix, but I think they are the beginning of stopping negative behavior and turning things around, is that they strip away all the unhealthy stuff and they force people to remember what skills they have and strengths they have. So I think whether it's a wilderness program, which are expensive and dramatic and all of that, and maybe not necessarily that not everybody needs that, but just thinking about those tenets, what makes those work so well, and bringing it back to the family or the classroom or the team or whatever young people you're working with.
That's interesting. Well, thank you. Thanks, Loree.
Thank you.
And we have some additional resources on these topics that we'll show as well. Thanks.